Hello, good evening to all the viewers who are watching live right now and who will be watching on the repeated. We welcome you in our 26 CME, and over here we got two eminent speakers for today. So without wasting any more time, let's just start our show.
Good evening, everybody. Good evening, sir.
Good
Uh,
evening.
Slowly but steadily and in a very confident manner, we are on the 26th episode of our continued medical education organized by National Institute of Homeopathy Alumni Association. And with me, I have tonight Dr. Devnaran Kalyani, sir, the president of NIH Alumni Association. And we have very important topic tonight to be discussed on is a protocol to prevent COVID-19 by anti-miasmatic complementary trio of arsenic, phosphorus, tuberculinum series, according to Dr. Hahnemann. And to introduce tonight's speakers, I'll request Dr. Devnaran Kalyani to call upon Dr. Pralay Sharma, who is the Deputy Medical Superintendent of National Institute of Homeopathy. Sir, please.
Very good evening to everybody. Secretary, quite competent Secretary of Alumni Association, Bidyut Mukherjee, Pralay Sharma, and all our viewers, and especially Dr. Asok Das and Dr. Ravi Nair. Both are gems of NIH in different ways. Anyway, we are very lucky that we got two very eminent speakers on a very specific and very interesting subject, which is very much necessary for present situation. Most of the medical science are feeling puzzling effect by the COVID-19 second wave. So most of us will be lightened by this seminar today. So thank you all, and I request Dr. Pralay Sharma to introduce both the speakers and to start the seminar. Pralay, please.
Good evening and namaskar. At the outset, I wish to send my best wishes to all the participants and the guests to stay safe and healthy during this pandemic time. I'm very privileged and honored to inaugurate today's 26th webinar on continued medical education organized by National Institute of Homeopathy Alumni Association. This pandemic caused by the SARS-CoV-2 made us to understand that the COVID-19 is a mysterious disease spectrum. The virus gets mutated within very short period of time, giving rise to different variants of virus, which can be more virulent than the earlier, causing serious concern around the globe. Some of the emerging variants are believed to be more transmissible and therefore have potential to increase hospitalization as well as death. For last 1.5 years, the whole medical fraternity and researcher concentrating on how to get out of this COVID-19, and every system of medicine of our country have contributed their best for the cause. Our system of medicine, homeopathy, also developed certain protocols to prevent the disease from its occurrence. One of such protocol is a protocol to prevent COVID-19 by anti-miasmatic complementary trio of arsenic, album-Phosphorus-Tuberculinum series, according to Hahnemann, which is well known as APT protocol. This we like to discuss today in this webinar. This protocol is already been executed and being executed in different part of the country after it got approval from Interdisciplinary AYUSH Research and Development Task Force, Ministry of AYUSH, Government of India, and from Central Council for Research in Homeopathy, Government of India. To talk on this subject, we have with us Professor Dr. Ravi M. Nair and Dr. Professor Asok Kumar Das. This protocol on discussion today in this webinar is a brainchild of Dr. Nair and Dr. Das. The aim of today's webinar is to sensitize all the alumnus of National Institute of Homeopathy regarding the APT protocol to combat COVID-19, and at the same time, we would like to request all of you, all the participants out here, to render active support and participation in APT protocol. We have with us today Professor Dr. Ravi M. Nair. He is DHM and DPNI. He happens to be first batch of DPNI student of our institution. He is advisor, Saroda Krishna Homeopathy Medical College, Tamil Nadu, right now. He is former advisor, Homeopathy, Government of India, retired principal and controlling officer, Homeopathy Medical Education, Government of Kerala, former president, State Medical Council of Homeopathy, Government of Kerala, former member, Central Council of Homeopathy, Government of India, former member, Special Committee on Clinical Research, CCRH, Government of India, founder, chairman of Rapid Action Epidemic Control Cell in Homeopathy, Government of Kerala, first recipient of Dr. Hahnemann Award 2015 of Government of Kerala for overall contribution to homeopathy. He is first recipient of Lifetime Achievement Award 2019 for the best academician in homeopathy, given by Ministry of AYUSH, Government of India. On behalf of National Institute of Homeopathy Alumni Association, I welcome you, sir. We have with us Professor Dr. Asok Kumar Das. He is MSc, BHMS, MD Homeopathy, PhD, and gold medalist. He is a former professor of National Institute of Homeopathy, Kolkata, World Health Organization Fellow, WHO Fellow on Cancer, National Institute of Health, United States of America. Former member, Drug Proving Committee of CCRH, Government of India. Former member, Council of Homeopathic Medicine, Government of West Bengal. Former Honorary Director, Pharmacy Course, Council of Homeopathic Medicine, Government of West Bengal. He is Chairman of Scientific Committee of West Bengal Branch, Homeopathic Medical Association of India. He is the author of various books, and one of the famous book is a treatise on Organon of medicine in 3 volumes. He has a fundamentals of homeopathic repertory, concept, method, and techniques, understanding Hahnemann's chronic diseases, their peculiar nature, and their homeopathic cure. On behalf of National Institute of Homeopathy Alumni Association, I do have the privilege to welcome you, sir, in this webinar. Thank you so much. I think Dr. Nair have joined this. Let me know whether Dr. Nair has joined.
No, not yet.
So in the meantime, I'll request Professor Dr. Asok Das to begin his lecture. In the meantime, if Dr. Nair joins, we will manage the time and we will act accordingly. I request Dr. Asok Kumar Das, sir, please. Dr. Das, please.
Good evening to everybody. It is audible. Is it audible? Hello? Is it
Yes,
audible?
sir, it's audible, sir. Yes, sir, it's audible, sir.
Okay.
Sir, just click on the hide button, sir.
Hide button? Button.
Yes, sir, the stop sharing. Beside the stop sharing.
Okay.
Yes, sir. Now click on the slideshow from the. Over to you, sir.
Okay.
Yes, sir.
At the very beginning, I extend my heartfelt thanks to the National Institute of Homeopathy Alumni Association, and also I thanks to all the participants. My respect to the President and all the members of NIH Alumni Association, and my dear students, colleagues. The subject is a protocol to prevent COVID-19 by anti-miasmatic complementary trio of Arsenicum album-Phosphorus-Tuberculinum in series. Now, at the very beginning, I want to explain that what do you mean by APT protocol? APT stands for A for Arsenicum album, P for phosphorus, T for tuberculinum. Protocol denotes a set of guidelines to be followed to achieve successfully a desired end. Here, the desired end is to prevent COVID-19. So APT protocol denotes the guidelines to be followed to administer these three medicines in series to prevent COVID-19 successfully. Now, before discussing the subject proper, I want to give an introduction, an overview of the whole homeopathic concept for the better understanding of the next part. As regards the scope of homeopathic treatment, all of us know that it can cure curable cases, it palliates incurable cases, and it prevents the different diseases. We have a successful past records of prevention of epidemic diseases by homeopathy since the beginning of homeopathy, and the diseases are like scarlet fever, typhus, Spanish flu, cholera, dengue, chikungunya, etc. in the recent past. Now, what may be the different types of homeopathic prevention? The homeopathic prevention may be a specific prophylaxis, which denotes the prevention of a specific disease, and that can be done by genus epidemicus or by some specific medicine like certain nosodes. And there is another approach of general prophylaxis, that is the prevention of diseases as a whole by some constitutional treatment. Today, I want to concentrate only on specific prophylaxis, that is to prevent a specific disease by homeopathy. So before discussing that, let us have a basic concept of homeopathic approach of prevention. And that is very, very important to all of us. As you know, to produce a disease, we need three things. One, the abnormally susceptible host. The second one, pathogenic agent. And the third one is the environment. This is the disease triad according to the concept of modern science. But the same approach can be applied in relation to homeopathy, where we say that a disease can only be produced in an abnormally susceptible host by some homeopathic miasm or by some miasm, and where it needs certain environment. So only thing we differ as regards the pathogenic agent in case of modern science, but according to homeopathy, think of miasm, and that is for in relation. I will discuss that part afterwards. So only difference in allopathy, they emphasize on the pathogenic agent like bacteria, virus, but we say something that prior to infection of a particular pathogenic agent, there is certain derangement of our vital force, which leads to the development of disease. So, an abnormally susceptible host can only produce the disease. Now, this is also the triad of disease according to homeopathy and modern science. Now, if we can break this chain at any level, I have shown you by arrow that if we can break that chain, we can prevent the disease. As for example, if we can improve our environment so that the pathogenic agent cannot grow, so we can prevent the disease. Another thing, that if we can kill the pathogenic agent, then the pathogenic will not be able to come in contact to our person, so there will be no disease. And the last one, the host factor. That host factor is very important, and here we differ from allopathy. Please keep in mind, as regards the environment, as regards the killing of the pathogenic agent like a sterilization, there is no difference of opinion in homeopathy. We must accept that there is a need of environmental sanitation, there is a need of sterilization to kill the pathogenic organism, and all these two things should be adopted by the homeopathy like that of modern science. But only thing we differ as regards the host factor, the human host factor. And that is the difference. I'll show you the homeopathic versus allopathic approach. Whenever we think of the human host, in allopathy, they produce a specific vaccine against a particular microorganism, and this is specific to that particular organism. And also, in relation to homeopathy, we do something different. We also treat the human host by using homeopathic medicine. It may be a constitutional one, or genus epidemicus, or by nosauds, or by some anti-miasmatic medicine. So, as regards the host factor, our homeopathic approach is different from that of modern science. So, as regards the stopping of the transmission of the virus by following hygienic measures, as regards the environmental hygienic measures, all are same. So I will concentrate my discussion only on our host factors. So please keep in mind that the basis of curative and preventive treatment in homeopathy both depends on two very important things. One is the law of similia, and another is the individualization. As you follow in curative treatment or palliative treatment the law of similia, so also in case of preventive treatment also we should follow this law of similia. And at the same time, the concept of individualization is also to be followed in homeopathic prevention. Now, what is the basis? So what will be the basis of prevention? Like that of treatment, we need to depend on the symptomatology of the patient. That is a very important one. But please keep in mind, as homeopathic approach is based not on the causative pathogen, but on the person, so that homeopathic approach remains effective in spite of the change of causative pathogens. As you know, at present, the COVID virus is changing its particular strain by genetic mutation. But if we treat from homeopathic angle, we'll show you that the homeopathic approach will remain effective in spite of change of strain of pathogens. And the third one, as I have already emphasized, the concept of individualization. Now, as regards the constitutional treatment, according to homeopathy, this is the best to prevent all types of diseases. Please keep in mind, I am talking all types, means if you have this constitutional treatment of a person, he will be able to prevent all types of diseases, including the different types of acute and chronic diseases. But it is not practically feasible to do constitutional treatment in an epidemic where mass people has affected. So the scope of constitutional treatment in an epidemic is not feasible. It is only feasible at particular physicians level, but it is not possible for mass treatment. The second one, the genus epidemicus. In fact, this is the classical and well-known method. Till date, all of you are quite aware of this classical approach that epidemic means we have to select one genus epidemicus. Another one approach is the use of nosodes prepared from the pathogenic or causative pathogen. As you know, the particular pathogen which is responsible for that particular epidemic, that can be potentized and may be given to the persons for prevention. Yes, some of the stalwarts says that this is nothing but isopathy, but at the same time, there is another concept that whenever there is potentization of a particular disease product to produce the nosode, there is change of nature. From that angle, this is not also isopathy. So please keep in mind, this concept should be known every one of us. One, it is isopathy. Another one say that as there is change of the product during potentization, so it is not the same. Please keep in mind there is a difference between same and similar. As you know, same means isopathy, similar means homeopathy. But due to potentization, as there is change of the nature of this particular product, it is no longer become isopathy, it becomes homeopathy. So lot of things, a discussion may be done in this regard. Let us think of the next very important one, that is use of anti-miasmatic medicines in case of epidemic diseases of chronic nature. Please, I emphasize that word, epidemic diseases of chronic nature. That is important. I will discuss in detail that part. I emphasize the genus epidemicus. As you all know, this is a commonly indicated medicines which are curative in most of the cases in a particular epidemic, depending on the totality of the symptoms of different patients. So if that commonly indicated medicine, if you administer to healthy persons, then the disease can be prevented. This is the classical approach of genus epidemicus. That means a genus epidemicus can only be selected after treating a group of patients. That is very, very important. Another thing is very important, that it is specific to the particular geographical area and at a particular time. And as you know, that the cause of epidemic disease, according to homeopathy, is the acute miasm. And this acute miasm may be of two types. One is recurring or non-recurring. That non-recurring type is known as the fixed miasm. And that is explained by Hahnemann in section 241. What about Kent? Kent followed the Hahnemannian guidelines, but he specified, Dr. Kent specified that if we treat about 20 patients, we can find out the genus epidemicus. And according to Dr. Kent also, that if we treat a group of patients like 20, 30, 40, whatever maybe, we may get 6 or 7 or a group of medicines known as epidemic remedies. And out of those few medicines, you have to select the most suitable one, and that is known as genus epidemicus. In fact, the basis of selection of genus epidemicus is always to treat a group of patients on the basis of individual symptomatology and then to find out which is most commonly indicated and effective, and then can be utilized for preventing the disease by applying to the healthy persons. But please keep in mind, it is very important one. In lesser writing, Hahnemann used the word, this sentence, a remedy that is capable of checking a disease at its onset must be its best preventive. I want to emphasize that word, a disease at its onset. That means the symptoms which are at the beginning of onset of a particular person, that should be the guideline for selecting the medicine. I can give one example, that suppose in case of COVID-19, what happens? The patient, there is watering from nose, sneezing, irritation in throat, then develop dry cough, followed by fever, all others. So what are the symptoms at the initial onset, and ultimately leads to pneumonia and multi-organ failure. But here, our homeopathic preventive, genus epidemicus, should be selected on the basis of the symptoms which are produced at the beginning of the disease. That is very, very important, and that is discussed in page 377 of Hahnemann's lesser writings. Now, as regards that, I concluded this genus epidemicus. Next approach, the use of nosodes. As you know, there are different nosodes like diphtheria by diphtherinum, anthrax by anthracinum, influenza-like illnesses by oscillococcinum, like, as you know. But in this connection, I must mention a very recent success by nosodes in Cuba in the year 2007 in the preventing leptospirosis. Very, very important. Prevention of leptospirosis in Cuba by using nosodes. What they did, there are 4 strains of circulatory, there are 4 circulating strains of leptospirosis. Leptospirosis is a bacterial disease, and it cannot be prevented by allopathic vaccination. Then in Cuba, they make a potentization of all the 4 strains of leptospirosis bacteria, potentized, and then it has been distributed to 2.3 million of persons in high-risk epidemic area, and totally the Cuba able to prevent this leptospirosis by that nosodes. So what I want to emphasize, that an epidemic of infectious disease can also be prevented by using nosodes produced from the same pathogenic organism. And the last one, Hahnemannian anti-miasmatic approach of prevention. Please go through the section 241 to 244. Due to constraint of time, I am not discussing each para of that particular organon, but I want to give one precise, a summary of all these 4 para of organon medicine. What was the observation of Dr. Hahnemann? That in case of treatment of epidemic of intermittent diseases, some cases are of chronic nature and they relapse, and such case of acute disease of epidemic, acute epidemic of intermittent fever can only be radically cured by anti-miasmatic treatment. I only show you the red portion of each particular para for your understanding. You see, the last one, that which is almost universally serviceable in those patients those who are not the chronic sufferers of, because what Hahnemann told us, because it will take long time. What Hahnemann say, that a group of persons who have latent sora, after being affected by this particular epidemic, they also develop soric manifestations. And that's why such cases will not be cured until and unless we give anti-miasmatic treatment. That's why you see the last line, we have now to do with a soric intermittent fever only, and this will generally be subdued by minute and rarely repeated doses of sulfur or hypersulfuris in a high potency. The last 243, we know that we have SORA on the point of development, and that in this case, antisoric medicines alone can effect a radical cure. Next, their intermittent fever cannot be cured in the Mercy district without antisoric treatment. Next, but they will never regain perfect health without antisoric treatment. So all this, particularly if you think of that, that intermittent fever cannot be cured. That means if a acute disease is of chronic nature, that kind of epidemic disease cannot be cured or cannot be cured by our anti-miasmatic treatment, antisoric treatment. Now, this concept is in relation to the treatment of chronic epidemic diseases of chronic nature. Please keep in mind. Now, the principle of treatment in homeopathy and the principle of prevention are the same. So, if you think of that way, that concept of prevention of or treatment of epidemic of intermittent fever can be applied in the prevention also. That's why I'm talking that to translate this concept, this theory to practice, the first successful application of anti-miasmatic treatment in the prevention of Japanese encephalitis. Please keep in mind what Hahnemann told in these 240 and 241 aphorisms. It was restricted earlier only on treatment purpose only. Now, this first successful application of this concept was applied in the field of prevention in case of Japanese encephalitis in Kerala and Andhra Pradesh. Actually, this part will be dealt by Dr. Nair. Just I am giving a very brief idea that in the year 1999 to 2004, there was an epidemic of Japanese encephalitis. Now, this Japanese encephalitis, during that time, there is no successful vaccination. Then Dr. Nair was the principal of Trivandrum Homeopathic Medical College. Now, this Japanese encephalitis, prior to the involvement in Andhra Pradesh, this Japanese was very much prevalent in Andhra Pradesh, but the disease was new to Kerala. Then, as it is a new disease in Kerala, Dr. Ravi Nair consulted Dr. G.L.N. Sastry. He was the superintendent of Hyderabad Homeopathic College. Now, this problem of Japanese encephalitis was prevalent in Andhra Pradesh for a long time. Okay, and Dr. G.L.N. Sastry was very much involved in the treatment and also the prevention of Japanese encephalitis in Andhra Pradesh. And there was a discussion between Dr. Nair and G.L.N. Sastry. And what G.L.N. Sastry advised that, well, we are trying to prevent this disease by some genus epidemicus like belladonna, like hyacinthus, like stamonium time to time, but we are not able to prevent the disease completely. So he advised, why not to consider this particular disease from miasmatic angle And that's why on the basis of that, Dr. GLN Sastry and Dr. Nair combinedly developed a protocol that is known as BCT protocol. B for belladonna, C for calcaria cough, T for tuberculinum. Now this concept was applied by Dr. Nair in Kerala, and he applied in the different districts within a short time, and I will show you that what was the result of that particular result of BCT project. In the 2000, the reported case was 343. The number of death was 62. 2001, the reported case was reduced after the application of the BCT, and only there was 4 deaths. In the next year, 2002, only there was 18 cases, no death. And in the year 2003 and 4, no case record of Japanese encephalitis in Kerala. This part will be more detailed discussed by Dr. Nair, that what was his experience. But what we can say, that after application of this BCT, 3 consecutive years, the Japanese encephalitis was totally eradicated from Kerala and Andhra Pradesh, and that was accepted by Government of India surveillance report. So this is the first application of the concept of anti-miasmatic management for prevention in case of epidemic disease that I have told. What was the conclusion in that BCT project? They advised that endemics and epidemics should be studied from the miasmatic viewpoint to understand their virulence, change of pattern and recurrence. Please keep in mind, during these 20 years of Japanese encephalitis, there are change of patterns of the virus, and as a result, the symptoms differs, and as a result, at different years, there is different types of symptoms are developed, and different medicines are indicated. But cannot be cured or cannot be prevented by some acute medicines. They come to the conclusion that this is, although an acute disease, but its nature is a chronic nature. Why chronic? It is recurrent and persistent. So it should be considered from miasmatic viewpoint. You can go through this particular paper, Efficacy of Homeopathic Prescription in the Prevention of Japanese Encephalitis between 1999 and 2004 in the state of Andhra Pradesh, India. The article was written by Dr. Sri Nibasulu Gudugu, and that was published in the Liga News, December 2018. So this is the reference of BCT. You can go through this particular article, and you will get the details that how BCT concept was developed and what's the result of that BCT in preventing Japanese encephalitis. I don't want to discuss further. If when Dr. Nair will come, he will discuss, give the much details. Now, in this BCT protocol, not only the concept of anti-miasmatic medication was considered, but at the same time, they applied the concept of complementary relationship. As a homeopathic physician, all of us know about the importance of second prescription in treatment. But this is the first time they applied this concept of complementary relationship in preparing a protocol of BCT. Not only they are anti-miasmatic, but they are complementary to each other. As you know, a complementary medicine means the medicine which completes the cure, which the other begins, but unable to effect, and that is the complementary. And this is the concept of Dr. Kent And this was applicable for the treatment of both acute and chronic diseases. But this is I told you, this is the first application of this concept of relations, the complementary relationship in the treatment of epidemic disease of chronic character. Please keep in mind, this chronic character is very, very important. Why we're talking, I will discuss that why we're talking that this particular COVID-19 is of chronic nature, like that of Japanese encephalitis. That's why we are applying the same concept in the prevention of COVID-19 also. Now, coming to specifically the present issue of COVID-19 prevention. As you know, the first advisory of Ministry of AYUSH to prevent COVID-19 was on 29/1/2020. Please keep in mind, on 29/1/2020, arsenic album-30 as the preventive. But the first reported case in India is on 30th January 2020 in the state of Kerala. But I want to emphasize that Ministry of AYUSH selected this arsenic album-30 prior to treatment of not a single case of COVID-19. Please keep in mind that what they did, they collected all the prevalent symptoms of COVID-19 in the different countries, and they are all common symptoms of COVID-19. Please keep in mind that there was no such scope of treatment during that period. But on the basis of the common symptoms prevalent in the different countries, they selected Arsenicum album. Even we also repertorize the different symptoms, and the first medicine is Arsenicum album. So as you know, the dose arsenic album-30 daily in empty stomach for 3 days, and the dose should be repeated after 1 month by following the same schedule till coronavirus infections prevalent in the community. Please keep in mind, such repetition is not according to Hahnemann guideline, that the same potency should be continued for an indefinite time. Not only that, just few days back, there was an advisory published by Ministry of AYUSH in case of children, Arsenicum album-30, 4 globules twice daily for 7 days. So the difference, 3 days for children, 3 days for adult, but why they change it 7 days for children, there is no such explanation. Anyhow, this is the advisory of Government of India. Now, what was the in favor of Arsenicum album? Please keep in mind that we also supported to be the one medicine to prevent COVID-19. Yes, arsenic album is a timely advocated medicine for prevention because there was no scope of treatment during that time. Please keep in mind. So what to do? We have to select the medicine on the basis of the pathological symptom. What I want to emphasize, that arsenic album is a partially similar medicine on pathological level. Whatever common symptoms we have get, that is nothing but the common symptoms. So we have given pathological similar medicines. So arsenic album is a pathological similar medicine. Second one, the fear and anxiety among the population. During that time, as you already offered us, there is a prevalency of fear and anxiety. From that angle, the selection of arsenic album is also correct. The sphere of action, it acts both on respiratory tract and upper respiratory tract and lower respiratory tract. If you think of the evolution of the disease in COVID-19, it starts from upper respiratory tract and ultimately goes to the lower respiratory tract. And arsenic album has the affinity at both upper and respiratory tract. The second one, we have a long clinical experience in the use of arsenic album in the different diseases of respiratory system. So we have come to the conclusion that arsenic album is a pathological and partially similar medicine. Please keep in mind, and that's why we also support this one at that level. But with the progress of time, it has been now very much clear to all of us the chronic nature of COVID-19. What is that chronic nature? It starts 1.5 years back, still it is going on, so it is persistent, recurrent. Yes, the same person also may recur the same disease, and not only that, after being suffered from COVID-19, there are long-term after effects. So on the basis of these three characters of COVID-19, that is persistent, recurrent, having long-term effects, that's why we're talking that this is a acute disease of chronic nature. So we need to find a pathological similar medicine with miasmatic consideration. And this miasmatic consideration is an alternate method which have the potential to prevent the disease. That's why we want to take the help of the conclusion of BCT study that endemics and epidemics should be studied from miasmatic viewpoint. As you already know, the chronic miasms no doubt is the cause of chronic diseases, but also it predisposes human being to different acute diseases. Please keep in mind, chronic miasm also responsible for predisposing human beings to different acute diseases. So anti-miasmatic treatment will remove the tendency of getting affected of a chronic disease, for an acute disease. So why need of anti-miasmatic treatment from philosophical point of view? That anti-miasmatic treatment, it modifies the susceptibility of the individual to normal, and as a result of which the tendency to be affected by prevailing epidemic disease will be eradicated, and that leads to prevention of an epidemic disease for a long time. Please keep in mind, if you give some acute medicine for prevention, it may be effective for some time. But if you want to have a long-term prevention of a particular disease like that of COVID-19, we need to consider from anti-miasmatic angle, because it modifies the susceptibility of the individual to normal, and that eradicates the tendency of the disease to be affected. So, and that has been already proved in case of BCT protocol in preventing Japanese encephalitis. Now I want to discuss COVID-19 for homeopathic angle. Please keep in mind, it is a epidemic type, as you already know. The producer is a recurrent type of acute miasm, and this is highly contagious, and the chronic nature, as I have already discussed. Before that, please try to understand also that how Hahnemann described epidemic disease in chronic diseases. Please keep in mind that if you study this, it is very similar to the present epidemic of COVID-19. So I will show you from the example of chronic disease, from the book of chronic disease, that what is related with COVID-19. Please keep in mind. In the chapter of Nature of Chronic Diseases, para 93, Hahnemann described the interaction between latent sora and epidemic disease. Please keep in mind, it is very important that what will be the interaction between the latent sora and epidemic disease. Now you say that in an epidemic, those who are healthy, most of the people have sora in the latent state. Now, whenever a person is exposed to an epidemic fever of acute infectious disease and being treated by allopathic treatment, the latent sora develops, leading to the development of several manifest soric chronic diseases. Now, if you see here also, many people after suffering from COVID-19 develops different types of chronic complaints. They are nothing but the different miasmatic manifestations due to conversion of latent sora to manifest chronic disease after being affected by an epidemic disease like COVID-19 and being treated after allopathic treatment. Please, whatever different types of lung fibrosis, I'll discuss one by one what are the different complications that develop. This is Hahnemann, and you see it is very similar with that of the present condition of COVID-19. That I have already discussed. Please keep in mind another one. The persons having sora in the latent state, when suffered from COVID-19, the dormant sora awakens to produce different manifest soric chronic diseases, that is post-COVID syndrome. The post-COVID syndrome. But I want to emphasize that whatever he has told, it is the very words. It is very similar. Just I am reading. But even while a person, whether a child or an adult, who has the sora slumbering within him, shows much semblance of health, but when his health and whole organism have been very much weakened and seconded by the prevalent epidemic fever, or an infectious acute disease, smallpox, measles, whooping cough, scarlet fever, purple rash, etc. Now we can add COVID-19 here. Then the sora, which was hitherto slumbered, awakens and shows itself in heightened and augmented symptoms enumerated below. In its transition to the formation of severe maladies, one or another of the nameless soric chronic diseases breaks out, and most of all through weakening and exhausting improper treatment by allopathic physicians. They are aggravated from time to time without intermission, often to a fearful height, if the external circumstances favorable for the patient do not interpose and cause a moderation in the process of malady. That means there is soric, latent sora, and that ultimately leads to the development of soric chronic diseases, what we have found now as a post-COVID complications. Another very important word, all of you know that as you all know that the fatality rate of COVID-19 is much more in persons having comorbid conditions like hypertension, diabetes, lung diseases, cancer, as reported in different studies. So this is the present observation, epidemiological observations that can be explained in the light of Hahnemannian writings in chronic diseases. Please go through the page of chapter Nature of Chronic Diseases, para 93. This is only the synopsis. Persons already a chronic patient. What I am talking, it is not my observation. It is written in chronic disease. Just I make one slide for easy understanding. The persons already having a chronic patient exposed to an epidemic disease leads to allopathic treatment, and that increase his disease and increase the difficulty of curing it, may make the disease incurable if violent. That means the persons who are already a chronic patient, after being suffered from an epidemic disease like COVID-19, being treated by allopathic treatment leads to certain diseases which becomes incurable. So Hahnemann distinctly described two aspects. One, the persons who have healthy, apparently healthy, having latent sura, and the persons who have already suffering from the chronic disease. What we are observing in this particular COVID situation, the same thing. So what Hahnemann told 200 years back, that can also be correlated with the present problem of COVID-19 in our in this pandemic. And that is the red line, just you say, these same events, if they occur in a person already a chronic patient, may not only augment his disease and increase the difficulty of curing it, but if they break in on him violently, may make his disease incurable. So this is the writing of Hahnemann. Now, very important, I want to now emphasize what is the miasm behind COVID-19. Before that, we must try to understand the pathophysiology of the COVID-19. That is very, very important. Still, we are regularly getting new information of COVID-19 and its pathophysiology. So it is still not clearly known or totally known. But there are certain facts which is already proved. That is COVID pneumonia having silent hypoxia. I will discuss one by one. The interaction with hemoglobin. Number 3, the disseminated intravascular coagulation and the cytokine storm. These 4 phenomena is very much interrelated with COVID-19. I want to correlate this pathophysiology with the concept of homeopathic miasm. Now, as regards COVID-19, the most important character that in COVID-19 or COVID pneumonia, there is silent hypoxia, the otherwise also known as happy hypoxia. Dr. Richard Leviton, a US emergency doctor, he concludes that the infection that's silently killing corona patients. So according to him, the diagnosis of hypoxia at the very initial stage is very important to save the life of the patient. The same concept we are applying, that this hypoxia should be diagnosed at the early stage so that we can save the life of the person. Now, why there is a silent hypoxia? Please keep in mind that is very important. In COVID pneumonia, what happens whenever there is inflammation of the lung, the air sacs collapse. And that collapse, there will be disturbance in the diffusion exchange of carbon dioxide as well as the oxygen. Usually, due to inflammation, there is a chance of collapse. But in case of coronavirus, when it attacks the lung, they produce certain chemicals which acts as surfactant. And those surfactant, what they did, they keeps the lung air sac open. And as a result of which, there will be removal of carbon dioxide. So there will be less accumulation of carbon dioxide. And the patient feel better in spite of deficiency of oxygen. Again, try to understand why silent hypoxia. We feel breathlessness whenever there is excessive accumulation of carbon dioxide in our body. But in case of COVID-19, certain chemicals are released in the lung tissue which acts as a surfactant, and as a result of which the lung air sac remain open so that they can expel the carbon dioxide. And although there is deficiency of oxygen in our body, but the patient will not feel the breathlessness. And that's why it is known as happy hypoxia. That means that there is dearth of oxygen in the body, but the patient can't feel it because the carbon dioxide is not being accumulated, and that's why there is no breathlessness. Okay? The second one, the interaction with hemoglobin. Now, SARS-CoV-2 causes hemolysis and form a dysfunctional hemoglobin with reduced oxygen and carbon dioxide transport. That means SARS-CoV-2 virus causes hemolysis, destruction. Next, through the autopsy of patients who died from COVID-19, some Italian pathologists, they first diagnosed the presence of platelet fibrin thrombi in small arterial vessels, which is consistent with coagulopathy. As you know, very recently in Kolkata also, there are certain autopsy of the persons who had died from COVID-19 to explore the pathophysiology of COVID-19, and the same findings was there, that disseminated intravascular coagulation in lungs. There are other epidemiological findings. Otherwise healthy young people dying of the COVID-19, while some aged person survives. You have seen in the newspaper, more than 90 years survives from COVID-19. On the other hand, the young, healthy person died of COVID-19. Why? The second one, the patient improves, but all on a suddenly died. Please keep in mind, we have many examples. We have seen the patient, okay, he is going to be released, but all on a sudden there is collapse and died. The cause of both the two is cytokine storm. I want to briefly say, the time is very limited, I want to briefly say that what is cytokine storm, and that cytokine storm is the cause of such type of result, epidemiological findings. I will say very briefly that whenever any virus enters in our human body, the immunological system swings into action. There are certain cells like macrophages. They recognize the foreign material like viruses and attempts to swallow. There are certain other cells like B cells, and that B cells produce antibodies, and that antibody attached to the virus label it that this is dangerous. Then the T cells come into act. They recognize that virus and ultimately destroy. That means, what I want to emphasize, that whenever a particular virus enters in our body, there are reaction or functioning of different immunological cells like macrophages, B cells, T cells, like that. There are more other cells. Now, in order to coordinate the function of the different immunological cells, there is liberation of certain chemicals, which is known as cytokines. The cytokines are protein in nature, and they coordinate. They are the chemical messenger and coordinate the functioning of different cells involved such immunological reactions. Now, this cytokines is responsible for many of the symptoms of the initial stage of COVID-19, like fever, like inflammation, like running nose, body ache. They are all the symptoms of flu, and that is nothing due to the release of cytokines. So normal release of cytokines is very, very important for normal immunological response to fight against the infection. Okay, so normal production of cytokines is very, very important. But in certain conditions, when there is severe case of flu, the cytokine production can grow out of control. That means which is beneficial to the person in its normal quantity, it go on releasing, and that leads to destruction. Please keep in mind, this is too much of a good thing. The cytokines, there are certain cytokines which are known as chemokines, and that chemokines causes destruction of the different cells. So whenever there is increased production of cytokines, there are increased liberation of the chemokines, and that chemokines are pro-inflammatory. That means they increase the inflammation much more. In normal condition, which can inhibit the inflammation, but if there is excessive production of cytokines, it induces inflammation. Please keep in mind, initially normal condition it can prevent, but if it is much more, then it increases the inflammation. And there is a positive feedback. Please keep in mind, positive feedback means more the cytokines, more will be the liberation of the different chemokines. More the chemokines, more will be liberation of cytokines. So there is a vicious cycle, and such immunological response damage the different other organs like lungs, kidney, and that leads to death. So why the young persons with full vigor died all on a sudden, but the old person survives due to cytokine storm. That means the same cytokines which is helpful to come out of COVID-19, if it is released too much, that becomes destructive. Now it is also very much prevalent or very much well known to us that COVID-19 is a multi-systemic disease. It is not only localized to only lung. Lung is the initial organ to be affected, but there are extrapulmonary manifestations, clot formation in the brain, limbs, and other parts of the body. There is cardiac involvement, different cardiac dysfunction, irregular heartbeat, autoimmune disorder, inflammation of the blood vessels, stroke, sudden collapse, all are the different manifestations of COVID-19. And as you know, all of us, this COVID, post-COVID complications, you know, all of us know the complications, lungs, heart, immune system, brain, elsewhere, involving multiple organs, worsening the previous comorbid condition and recurrence, and complications like chronic fatigue, more lung fibrosis, cardiac issues, they are all the complications of COVID-19. Now coming to the main, what is our intention to discuss? The highly soric nature, highly contagious nature indicates SORA, the silent hypoxia, syphilis, hemolysis, syphilis, coagulopathy, syphilis, the cytokine storm, the autodestruction nature of this disease, that is also syphilis. Loss of smell and taste, abrupt, unexpected deterioration, even death during apparent recovery, the changing pattern of symptoms and the changing pattern of the strain of virus due to genetic mutation, the destructive nature of the post-COVID complications, they all indicates a combination of SORA and syphilis, and that is tubercular miasm. So from this discussion, we can conclude that COVID-19, the cause is tubercular miasm. Now I'm coming to the anti-miasmatic complementary approach. So what I want to emphasize, that only symptomatic treatment without considering the miasm may palliate COVID-19, but will not be able to cure completely. There will remain every chance of recurrence of the disease and development of post-COVID complications. Please keep in mind, only by giving the symptomatological treatment and also the treatment or management, the permanent prevention is not possible. In this regard, I just want to read out what Dr. J.H. Allen say. The gist is that we have to consider to cure the disease completely from the root. The medicine will not only similar to the symptom totality, but also it will be suited to the nature and action of chronic miasm, which causes the disease. What I want to emphasize, that this concept of treatment can equally be applied in prevention. That's why I'm talking this one, that not only the symptomatic medicines, acute medicines, but also we have to consider certain medicine which can also cover the miasmatic aspect also. So another line, we cannot select the most similar medicine possible unless we understand the phenomena of acting and basic miasm. For the true similar is always based on the existing basic miasm, whether we be conscious or unconscious of the fact. The curative remedy is the certain pathogenesis of an existing miasm. Please keep in mind, the curative remedy is the certain pathogenesis of an existing miasm. Now, arsenic album-Phosphorus-Tuberculinum. This I you know. So, please keep in mind that this arsenic album cannot cover the whole spectrum of COVID-19. Please keep in mind. We have to consider some other medicine to cover the whole spectrum of COVID-19. And that's why we considered two other medicines, that is phosphorus and tuberculinum. Now, what was the basis? Why we selected phosphorus? In our repertorization of COVID-19 symptomatology, although they are common symptoms, the second indicated medicine was phosphorus. But initially, we have a discussion with some CCRH members that they discarded phosphorus because there was no bleeding manifestations. But afterwards, we have seen that although there is no bleeding manifestations externally, but there is internal disseminated intravascular coagulation. So there is a coagulation defects in relation to COVID-19. So phosphorus is a drug which can cover also this anti-hemorrhagic. As regards the sphere of action, phosphorus is more affected in lower respiratory tract. And if you see the pathogenesis of the disease, beginning from the nose to the ultimate one, this is very similar to phosphorus. Phosphorus is indicated in the latter stage of the disease when complications like pneumonia develops. Yes, phosphorus is usually develops when there is pneumonia. Phosphorus tubercular diathesis is more prevalent in Indian population. I will discuss it also miasmatically similar. Phosphorus is complementary to arsenicum album. Phosphorus also covered the hemorrhagic diathesis of the person. So from that angle, we included phosphorus as a next drug. As I have already told you, it is the findings of the Italian pathologist that was done initially, but in our country, in Kolkata, even the same findings was given by autopsy. Now, what about tuberculinum? That is very, very important. When we selected this particular tuberculinum, there was a news that in countries where BCG vaccination is compulsory, the fatality rate is less. And that's why it is the findings of certain US scientists. The time is short. If you just go through the some of the New York Institute of Technology, they concluded that BCG has certain power to prevent the fatality of COVID-19. And that's why in different countries like Australia, New America, they are giving BCG vaccination to the front workers like doctors, nurses, paramedicals who are dealing COVID-19 patients. Now, what we think at that time, we discussed with Dr. Nair also, that yes, the BCG vaccination and our tuberculinum both are produced from the same source. Only we differ as regards the preparation. So in BCG vaccination, if they prevent the COVID-19, so also this tuberculinum, our tuberculinum may have certain effect. Now, what is the scientific evidence of protection of BCG vaccine? Please keep in mind, these are all published papers. BCG vaccination induce potent, non-specific immunity against bacterial and viral pathogens. It diminishes the susceptibility to various respiratory infections. Please, you just remember all those things. This is a scientific study that it diminishes the susceptibility to various respiratory tract infections. It reduces the risk of pneumonia upon BCG vaccination of elderly people. These are all the references. Please, there is no time to discuss. If you can have a slide or if you take a snap, these are all the references that how BCG helps in preventing the different respiratory tract infections. I am concluded. I have taken all those references from these journals. These are only few. There are about 20 to 25. I have taken few. There is another study. BCG causes, BCG mechanism of action is mediated by heterologous lymphocyte activation and the initiation of innate immune memory. Please keep in mind, it stimulates innate immunity. If you think, if the time permits, I will discuss that innate immunity and acquired immunity and what's the difference and in relation to COVID-19 and allopathic approach and homeopathic approach. But what I want to emphasize that BCG causes stimulation of the innate immune memory, and that is the reference. Another thing, in India, possible role of environmental mycobacteria. TB endemic in India with high population density. Over half of the population are positive for tuberculin skin test. Like BCG, it is it can be hypothesized that environmental mycobacteria induce prolonged alternation in the immune system that results in increased level of innate and adaptive immunity. Perhaps you have seen, or many of the countries say that Indian people is very strong enough to fight the COVID-19. One of the possible roles that this particular organism, TB, is almost many of the people of our country is being affected, not only directly, but through environment. And that stimulates our immune system, resulting in increased level of innate and adaptive immunity. What I want to emphasize, that BCG has the power to develop our immunity against COVID-19. If we follow that one, the same concept in our homeopathy, that the environmental mycobacteria might have induced similar immunological memory, eliciting lymphocyte response and trained immunity, making epigenetic alternation in the similar mechanism to BCG at the promoter sites of various genes encoding inflammatory cytokines such as interleukin-1, interleukin-6, tumor necrosis factor, resulting less cytokine storms compared to non-exposed population. That means the BCG has the power to prevent cytokine storm, and that has been published not only by self, it has been the observation of the different immunologists This is the reference. Now, points in favor of tuberculinum, as you know from homeopathic aspects, it is a deep-acting constitutional medicine to prevent different diseases, including respiratory diseases, and they boost up the general immunity. All of us in our clinical practice we have seen from miasmatic point, the symptomatology of the present epidemic of COVID-19 appears, tubercular nature of the disease that I have already explained. The tubercular diathesis is much more prevalent in India. Persons of tubercular diathesis are more prone to develop respiratory diseases with complications. So the points in favor of tuberculinum, this tuberculinum is again complementary to phosphorus. That means phosphorus is complementary to arsenic. Tuberculinum is complementary to phosphorus. And we have seen the efficacy of tuberculinum in preventing viral diseases like Japanese encephalitis in Andhra Pradesh and Kerala. So what we have done, we have integrated homeopathic philosophy with the present concepts of science. What was observed by the UH scientists, what was observed by the different scientists, immunologists, that concept we have correlated with homeopathic philosophy, and that leads to the development of this APT protocol. On the basis of that, in fact, we wrote a letter to the Prime Minister, and ultimately we submitted one project to CCRH. This is the study project, a multi-centric, community-based, double-blind, randomized, placebo-controlled intervention trial for prevention of COVID-19 using homeopathic medicine schedule, arsenic album-Phosphorus-Tuberculinum in series, a new practical approach of considering complementary trio with miasmatic consideration. Now, this was approved by CCRH, followed by task force. And what was the dark schedule? Just want to say, arsenic album 30, 4 globules to be taken at morning in empty stomach for 3 consecutive days. We have supported the advisory of Government of India as advised by CCRH. But we want that arsenic album needs to be supplemented by other medicine to cover the whole spectrum of COVID-19, considering the miasmatic background. And that's why after 15 days, phosphorus 30, similarly same dose for 3 consecutive days, and after 15 days, again tuberculinum 200, only for 2 days. Now, up to this, we have given to the project approval during that time, because during that time, the nature of this particular disease was not known at that stage. But after that, we have extended further, considering the virulent nature and persistent nature. Here we have advised after 15 days tuberculinum 1 dose, after 15 days tuberculinum 10 ml, only 1 dose, so that the whole course can be covered within 2 months. What we expect? We expect, number 1, the reduction of COVID positive cases. Please keep in mind, reduction of COVID-19 related complications, and thus less morbidity and mortality. Not only that, it also helps to prevent post-COVID complications. That means the whole spectrum of COVID-19 can be covered by this particular APT protocol. As I have told you, this as it modifies the susceptibility of the person to the normal, so APT protocol will be helpful modifying the susceptibility of the individual to the normal. Even the virus changes strain by genetic mutation. So our particular homeopathic approach is not on the basis of the particular organism, for the person as a whole, so we can prevent the disease from beginning to end, even the different variants of SARS-CoV-2. Now, what is the only deviation we have done here? As you see, that in case of the second prescription, the first we have to give after the action of the first prescription is over. But in case of APT protocol, we can't able to follow this rule because of epidemic nature of the disease. It is not possible. So only deviation in case of second prescription, classical second prescription, that we have to give the medicine every 15 days interval. Only deviation we have done. Yes, the safety. APT protocol is very, very safe. There are certain confusion among some colleagues that use of phosphorus, use of tuberculinum, but phosphorus 30, not if you give it, no, there will be no problem. If there is no such irreversible pathological changes, 30 only 3 doses, nothing will happen. Even tuberculinum 1m, 10m, 1 day will not be will be effective. Not only it has been theoretically, we may say, but we have applied this particular protocol. I'll discuss afterwards. And even this protocol, this tuberculinum 10m, 1m was given in case of children, lakhs of people in Andhra Pradesh and Kerala for preventing Japanese encephalitis. Not a single adverse effect was observed. That means we have wide use of tuberculinum 1m and 10m, children and other persons. But at the same time, what we can say, this is safe, simple, scientific, economic, effective medicine, affordable and acceptable, available and applicable to all. We have seen only 10 to 15 rupees per person will be able to implement this particular protocol. Dr. Nair, I don't know whether he has come or not. This is the slogan given by Dr. Nair, that it is safe, simple, scientific, economic, effective medicine, affordable, acceptable, and available and applicable to all. Even we say in case of COVID vaccine, there are certain contraindication. We can give our homeopathic protocol to all persons, but definitely if it is possible by our colleagues, we can share that if there is irreversible pathological changes, suppose active tuberculosis, person who have excessive hemorrhage, bleeding at present, that we should not give this APT protocol. Otherwise, all persons can be given protocol in this particular dose. So there is no such contraindications. I don't want to discuss. Please, in this regard, I want to refer one of the WHO recommendation. During Ebola outbreak in 2014, expert group of WHO recommended that it is ethical to offer unproven interventions with as yet unknown efficacy and adverse effects as potential treatment of or prevention, keeping in view no vaccine or antivirals were available. That means WHO recommended that if there is no effective vaccine or treatment in any case, then it is not ethical to offer unproven interventions. So homeopathy, if you think of on that aspects, we can use it safely. These all drugs are safe, although it is unproven, but from homeopathic philosophy, what we are doing is applicable. We can apply this particular concept, because in homeopathy, while we are prescribing Bryannia, Nux-vomica, Lycopodium, we are not giving on the basis of a clinical trial. We are giving on the basis of the homeopathic philosophy, homeopathic principle. What is need of the scientific study? That what we are claiming, whether it is correct or not. So as the life of the person is much precious than our science, so for the time being, we can adopt this protocol, but at the same time, we can continue our scientific study to prove that how far it is efficacious. So what I want to emphasize that we can adopt this protocol for the time. At the same time, we can conduct certain scientific studies. This is the reference of the WHO. Please, this is another thing. Whenever this particular project was sanctioned by the government of India, there was a condition that as we have to conduct this study in 6 different states, we need to take permission, approval from the respective states like West Bengal, Delhi, Maharashtra, Gujarat, Tamil Nadu, and Kerala. But unfortunately, only 2 states, one is Delhi and another is Maharashtra, they permitted us to take this particular clinical trial. Gujarat approved the proposal, but they say that it is not possible for them to provide any homeopathic doctors from Gujarat. So at that pandemic situation, without the local help, it is not possible to undertake any clinical study. So we felt to materialize that clinical study, which was very scientific. What we do then, considering the WHO recommendation, we have done certain observational study since the beginning till date through our colleagues, students, homeopathic lovers and supporters, and we have distributed this particular medicines. Now at present, today I am talking, more than 2 lakhs people in our country and abroad. Now what was our observation till date? Within this particular 1 year, we have collected the information. Most of the people are not affected. Most of the people are not affected by COVID-19. Few persons who are affected had mild symptoms and recovered shortly. Very few persons with comorbidity needs hospitalization, but no case fatality, no death has been reported till date. We are preparing the statistical analysis of the result, but it is an observational study. Please keep in mind, in scientific studies, observational study has very least value. That's why there is a need of proper scientific study to evaluate the efficacy of homeopathic prophylaxis, including APT protocol, no doubt. But at this juncture, it takes time and nobody is coming forward to do this study scientifically. Even CCRH are also doing observational study of Arsenicum 30, and that is only for 3 weeks. Please keep in mind, only 3 weeks observational study was done as regards Arsenicum album, which they have published. So, and not only that, this is observational study, and that has no value, almost no value in the eye of the modern science. What is my intention? That it needs double-blind randomized clinical trial. It needs to include relevant immunological parameters in relation to COVID-19 to study the changes produced by homeopathic medication. What is my intention to preach all of you? That someone should come forward to study this, not only observational study, but to include certain immunological parameters in the scientific studies, so that we can boldly say that this is effective. Let CCRH, NIH and other homeopathic colleges should come forward to undertake such scientific studies. But unfortunately, we are fighting from different angle, from government, even in the legal issues we have developed to overcome the problem. But what we'll do when nobody is coming forward to take scientific studies, whether we will allow the people to die? No. Homeopathy approach of prevention and treatment is based on not on clinical trial. but on homeopathic philosophy and rules, regulations. Let's all of us try to adopt this particular protocol and see the result. I am not preaching. You adopt this protocol and you see the result. But at the same time, it is my earnest request to all of you, if someone come forward to do immunological, to do certain research from scientific aspects, until and unless scientific study will be there, the modern people will not be accepted in spite of our best result. So all the audience participants, if you have certain scope, do the research works, not only observational study, but also we need to include certain immunological parameters to be studied after giving homeopathic medication. So I appeal to all of you to adopt this APT protocol to save the health and wealth of our country, along with recommended general prophylactic hygienic measures. Please keep in mind, at the initial stage of my discussion, I told you that as regards the environment, as regards the sterilization and others pathogenic to kill the pathogenic agent, there is no difference between allopathic approach and homeopathic approach. So we should need to adopt APT protocol, but at the same time, we have to follow the recommended general prophylactic hygienic measures. As you already know, maintaining high personal hygiene, washing hands, using masks, maintaining social distancing, avoiding touch eyes, nose and mouth, and avoiding close contact with affected sick person. It is nothing but to prevent the contact of the pathogenic organism to the host. So we must adopt these particular parameters or particular general measures also, along with homeopathic APT protocol. It needs public awareness, developing public awareness regarding the scope of homeopathy in combating this challenging pandemic. Let us unite to save the health and wealth of nation and humanity at large, and to fulfill the dreams of our master Hahnemann. So I request all of you to try among your friends, your close relatives. To be frank, till date, my friends, my patients were close to me. None of them died of COVID-19. You can do similarly also you. So it is my earnest request to all of you to adopt this protocol. Clinical trial, no doubt, this is only to prove the scientificity. Yes, it is effective or not, how it acts, okay. But at the same time, at this juncture, it will take time to prevent or to save the people of our country. We need to adopt this protocol. You see, there is a chance of coming of the third wave, but there is a fear the children will be affected. Please, you also give this protocol to all persons, even after taking the vaccine, to prevent the recurrence also. We can adopt this one. So with this, I conclude my lecture. That please, accept, please adopt this and see the result. You also say that if it is effective or ineffective, see the result. It is our earnest request to all of you. Thank you all. Thank all the participants for your patience hearing. Thank you all. Hello. Hello.
Thank you, sir. Thank you so much, Asok Das, sir. I recall the days when you used to teach us in the classroom. We all are your students, and it's been very well today, this evening, on sharing the dais with you. And you can see, sir, Asok Das, sir, the full of applauses in the screen. Your ex-students has given their best wishes to you for the APT protocol. And thank you, sir, for sensitizing us regarding the APT protocol and its significance in the light of homeopathic philosophy. Sir, Dr. Nair, sir, is waiting in. I request Orko to bring Dr. Nair on the screen.
Over to you, Dr. Nair. Sir, please unmute yourself.
Sir.
Yes, sir.
Sir, Ravi M. Nair, sir. Thank you for waiting for a long period, long time. And in fact, we were waiting for you in the beginning. And as I said, and for the participants, we are very proud that we have with us today Professor Dr. Ravi M. Nair. And to talk about him, as I said earlier too, that he is our first batch DPNIT, and we are very proud to get him on this dais. Dr. Nair is the advisor of Sharoda Krishna Homeopathy Medical College, Tamil Nadu, a former advisor Homeopathy Government of India, a retired principal and controlling officer of Homeopathy Medical Education Government of Kerala, former President State Medical Council of Homeopathy Government of Kerala, former member Central Council of Homeopathy Government of India, former member Special Committee on Clinical Research CCRH Government of India. He is the founder chairman of Rapid Action Epidemic Control Cell in Homeopathy Government of Kerala, and he is first recipient of Dr. Hahnemann Award 2015 of Government of Kerala on for overall contribution to homeopathy. He is first recipient of the Lifetime Achievement Award 2019 for the best academician in the field of homeopathy given by Ministry of AYUSH Government of India. Nair sir, on behalf of National Institute of Homeopathy Alumni Association, I welcome you on this webinar, and I request you to begin your speech on your topic on your APT protocol. Thank you, sir. Please, sir.
Hello. Hello, good evening.
Very good evening, sir.
Good evening, sir.
I am Dr. Ravi M. Nair. I was introduced already by your anchor. I am thankful to him about he has given my biodata in detail. I had been in the first batch of the NH course, DPNH program, that was in the year 1977 to 79. And that say that my colleagues, Dr. Chandrabhuj Naik and he became the Director General of the CCRH, and again Dr. Ishwar Das and Dr. Samir Bhattacharya and Dr. Somen Adhikari, and all of them become the director of the NH. And I got we are the Dr. Niranjan Mohanty is a great teacher he became the principal of the Odisha. My colleagues were came to at the top level of the different field of homeopathy, or especially in the academic field. Okay. Now, I thank to first of all, I express my my sorry to for the earlier part I could not participate in your webinar, and again my age is during the first batch of the study. I was the senior man. At that time, I got that I was the only married man with the 2 children, and all others were bachelors. And now I am crossing the 77, and now the 78 is running. So please excuse me for that. I am not able to talk much more time. And I can anyhow that I must thank Dr. Asok Das. He has already explained everything about our APT protocol in detail, and the relevance of the miasmatic approach, and again that it is the necessity of the inevitability of the already described, but he left the only one portion, that is about the BCT. See, actually that it was when the ministry published their advisory on March 6th of 2020. At that time, on the basis of the information got from different country, it required not only the salve is the right remedy, the basic remedy, but it needs some more supplementation of the complementary, as in the case of PCT experience. So actually that we have submitted one first representation to the ministry on 27th March 2020. That is for the preparation of the nosocov, that is on the line of by site gain in the leptospirosis. But here thereafter we have given another representation to the ministry or the authorities at national level, that is for the status that was relating to the strategy to be formed, that we should be given the preventive. Along with that, the homeopaths should also be permitted to treat homeopathy according to the homeopathic principle. And again, that another proposal we have given, we should be allowed to add on therapy in the patients who are undergone the treatment in the modern medicine hospitals. There all the auxiliary measures or the facilities are there. So that thereafter we came to know that nosode preparation, or even if it is already prepared, then it may take a lot of time for the proving its efficacy in the clinical trial. But then at that time we have proposed that Arsenicum album is the right remedy, but it needs some more supplementation about that for the one more drug, as in the case of BCT, that is Belladonna calcarea tuberculinum, that medicine, that protocol intervention could the Japanese encephalitis in Andhra. Japanese encephalitis, it was started in one of the districts in the year 1979, but it lasted in the Andhra Pradesh for 20 years, and it spread nearly out of 23 districts. At that time, Andhra and Telangana was one single state. It affected 15 districts, and the number of children died, and the thousands of people got affected, and thousands of children got the constitutional problems and a lot of trouble. And in such situation that they have tried then the prophylactic vaccine made by vaccine in the 1941 itself, but it was very highly costly one. But even then, they have tried their level best to distribute to contain that epidemic, but they could not. And even that it was very interesting to note that even after the vaccination, they could after the final assessment of the affected, the 40% of the children already got the full vaccination under the modern medicine, they have got the JE, Japanese encephalitis. So that means that shows that vaccination is not the final answer to that kind of viral infection. So that is relevant here also in our case also. So now everyone in our case, now everyone is thinking that the vaccines are available at present, so that the government authorities are also thinking that is the final word. So no need of further other methods to be adopted. Then I wanted to point out that the factor in the recently that day before yesterday, one media, the vaccines cut risk. That's one study has done at the Vellore Medical College in Tamil Nadu, Vellore Medical College, and a very serious study they have done on the basis of the effects of the vaccines. Then they found that it is the report. The study found that among the 7,080 the healthcare workers who received affected vaccine offered 65% protection against infection. Only 65%. Those who have taken 2 doses already taken. 77% protection against the hospitalization. 92% protection against the need for the oxygen. And 94% protection from ICU admission. See, this shows position about the vaccination, the effects of vaccination, or how could be it could be a final that medicine or the final that preventive final prophylaxis for this pandemic. It is very difficult. See, that is here it shows that nearly that 65 means 35% of people, even after the taking vaccination also, they may also liable to get the COVID-19. Sometimes this much percentage of protection may not be there. So it shows that what happened in the case of Japanese encephalitis in Andhra Pradesh, and even after the vaccination had taken everyone, after that 40% of people, children who had the vaccination, got infection of the Japanese encephalitis. So here in this situation also, that the protocol is much more relevant, and this study report was there already published in the journal Mayo Clinic Proceedings the last week. So you can refer that journal. Then again, that another important factor that here that Dr. Asok Kumar Das left the details of how we came to the conclusion of this. Arsenic is the basic remedy. We want the supplementation of the complementary trio like the BCT. So actually in the year 1994 there was an outbreak of unexplained epidemic of fever among children in 3 adjoining districts of Kottayam, Alappuzha and Trivandrum. These districts are just south to middle of Kerala, and with very high 25 children died within 2 months. The Institute of Virology, Pune, diagnosed later the disease is the Japanese encephalitis. Then at that time, I was holding the post of the principal and controlling officer of the homeopathic medical education at Trivandrum. Then I had got the all the at that time also I had been in the CCRS in the committees. So I used to get that homeopathy has got the answer to prevent that epidemic, that viral disease. At that time, immediately I brought this magazine and I taken the magazine and shown to the represent before the then health minister and the health secretary, and both of them they did not allow to, because it was not approved by the WHO. So they are reluctant to undertake that work with the allotted the work to they are right, because finally that I pursue the matter for continuously for pursuing that for the obtaining the permission to study the cases in those student the number of hundreds of student children and affected persons were admitted in the isolation wards of the Alappuzha and Kottayam Medical College hospitals, and there we went their symptoms and other things, and thereafter we came to know that we have analyzed and we have analyzed the separately in separate form and separate location that and finally we came, both of the team came to the conclusion that it is belladonna, and immediately I got the answer belladonna from the concerned teams, and I consulted with the Dr. GNN Shastri, who was also then he was my that colleague at CCH, Central Council of Homeopathy, at that time, and I came to know that he was doing some work on the Japanese encephalitis affected in his state. He was the superintendent of the and professor and superintendent of the collegiate hospital JSPS Homeopathic Medical College in Hyderabad, and immediately I discussed with him. Then he told that he got there were a lot of medicines they have given, and they could not contain this epidemic, endemo epidemic. So thereafter, every year it comes usually in the months of between August and December. That is the time. Every year it's recur. So recurring nature of the thing and the persistent nature, and then the problem was then that Dr. GNN Shastri, I told him that we have found out the genus that indicated drug, that is, he told that we are also giving belladonna now. Previously, many homeopaths are giving that stramonium and hellebores and opium. They have tried many medicines. As in the case now, as we have our professional people are doing in the COVID pandemic also. Different approaches are there. Different medicines are suggesting. There is no unity among the homeopaths. But that situation was prevailing in that state also. And finally, they also came to understand could contain for that particular year. Thereafter, again it recurred the next year and spreading. So Dr. Shastri is a very great teacher, and he told me that we are also thinking about the anti-miasmatic approach laid down by the Dr. Hahnemann, as is described in the aphorism 2041-44, and Asok Kumar Das here, and on the basis of that, we have discussed and finalized. It would be, since belladonna is a vegetable drug, vegetable origin, that plant kingdom. So we need some mineral analogous of the belladonna for the chronic of the belladonna, that is Calcarea car, followed by the tuberculinum. Tubercular miasm is the predominant one. All other pictures are showing BCT. That's through that his explanation, we came to conclusion that BCT. That BCT was not given there, but at that time also every year they are giving only belladonna 200. Okay, thereafter that I had taken here, since it was my responsibility to finalize the medicine at that time. So I have suggested that BCT in here in 1994 August, and we have distributed. We have given to belladonna 200 for 3 days consecutively, and thereafter, and on the that 10th day that we have given the Calcarea cup 200, and again that after the 21st that 25th day, that is after giving the 15 days after Calcarea cup tuberculinum vannam. We have given only vannam at that time because that was the only medicine available at that time, and we have distributed medicine because all the children are dying, and no remedy was there. Even no vaccination is distributing, and there is no scope for the vaccination. They came to understand, and finally, due to that many people, all of them are collected our medicine from our dispensaries in almost all the panchayats. We have had a government dispensaries, and and through other private organization and distributed, like very widely distributed, and every parents have given the medicine very systematically. And what happened is, after giving this 3 plus 2 plus 5 plus 1, that is one dose of the tuberculinum 1000, and thereafter that at that time that the modern medicine people and IMA people have told this will come again, and this homeopathy cannot prevent it. That was their challenge. After that, even that after giving this medicine, within 2 or 3 weeks, that the spreading could be contained, and then this IMA people has told, yes, again it will come the next year, the most serious form, and it could not control. It will recurring nature. So we are also that feared that we have given the medicine. Thereafter, the authorities came to that before going to the sanctioning of the fund, the secretary actually threatened me that if any failure comes, or if any complaint in the Consumer Protection Forum, are you prepared to answer it? Then I told him, yes, sir. Then he immediately was forced to sanction the fund and to undertake this preventive the prophylaxis program, and distributed that since the parents and public are panicked, and so everyone has observed whatever the instructions they given, those things are that they kept in observation. So what will happen after that? Then next year we expect some that again that this outbreak may occur. Thing happens. And this was observed by Dr. J.L.N. Shastri and Andhra people. They waited for another 3-4 years. And then 94, 95, 96, 97, 98. Then 3-4 years, nothing, the Japanese sensibilities did not recur in Kerala. They came to understand that approach is the right one. That is that Hahnemannian approach is the right approach to contain these kind of the chronic nature of the endemo epidemic. It is endemic disease, but it is at the same time, so many other districts, so many other states also, West Bengal, Bihar, UP, Assam, and many other states had the same the Japanese sensibilities. But in southern India, in Tamil Nadu also it was there. In the southern India, that it affected only the 15 years old children, below 15 years. But in the northern India, it was noted that it was affected. No age difference, even the senior persons were also affected, this Japanese encephalitis. So that shows that that experience has given me a great lesson, a great that confidence. And whenever any epidemic comes in the nature of the viral diseases comes and spreading very very that hastily persisting nature, and this approach would be the effective one. That I have learned from that experience, that confidence with me. So when I got the information from the Wuhan and other details, other data from some other sources, it was recurring in several at that time itself. So I thought it would be better to give an anti-miasmatic approach. So my friend, immediately I contacted Dr. Asok Kumar Das, because who was I am considering as one of the top most that authority in the case of the philosophy, homeopathic philosophy, Organon. He wrote so many books on those subjects, repetition, and he dealt with the miasmatic approach very scientifically, and he has already presented before you. So immediately I have discussed with him that after giving the strategy developed that so immediately, it would be better to suggest this support the Arsenicum album with our suggestion that APT protocol. APT protocol, the relevance and everything is explained in detail by Dr. Asok Kumar Das. I am not going to that area. That is so. This is very, very effective. And before the year, I will go through the genus epidemicus selected on the basis of the symptomatology of the epidemic prevalent in Andhra Pradesh only, rendered temporary relief. In 1999, the epidemic of JE occurred in the Rayalaseema districts and spread to the other districts in the state. At first, that time, late Dr. G.L.N. Shastri reviewed this disease from a holistic point of view and explained the tendency of the recurrence. He suggested the unique way of prescribing the 3 remedies in series termed BCT as follows: Belladonna 200 on 1-2-3 days, 1 dose each day, as we are doing in the Arsenicum album, 30 for 3 doses, first 3 doses, and Calcarea carb 200 on 10th day, and tuberculinum 10 on 25th day. He used tuberculinum 10, but we have used that time only in the market. Symptom similarity, complementary relationship, virulence, and underlying miasms were taken into consideration while selecting these drugs. The above medicines were administered following the above protocol every year in the month of August for 3 consecutive years. And starting in 1999 to about 20 million children from birth until prone districts in Andhra Pradesh with the support of the state government. The results of these interventions were monitored by population-based surveillance of incident of JE cases post-intervention, including tracking of associated morbidity and mortality. JE cases and related deaths were documented by the Department of Health, Government of Andhra this. The results after the commencement of the BCT prophylaxis and treatment in 1999, both mortality and morbidity rates of JE cases fell drastically in Andhra Pradesh. A total of 343 cases were reported in 2000. That is, previously it was in the, we have taken the details, and from 93 to 99, that 6 years, 5,308 got affected. And those in that period, 1,511 children died. Then if you take the average per year in the previous 6 years, that is, and the infection got the nearly 885 per year, and the death rate become 252 per year. So in that, medicine was distributed in the August 1999 August, and they observed the result in the 2000, and 2000 again that it came to the, out of this 855 cases are infected, it is reduced to the 1/10 of that previous year, that is 343 only. And the death rate is 72. In Dr. Asok Kumar Das slide, it was recorded as 62, but it is not one. Again, it was distributed in the another 2000. Again, that result was observed in the on 30 children only got infection. That is, that shows that out of that 1/10 of the previous year number and the affected number. The death rate also reduced to from 72 to 4 only. Only 4 children died, and that shows that is also 1/10 of the previous year. And again, 2012 only 8. And see that after, before introducing this VCT program, there it was average was the year 885. From within a short span of time, the 3 year, with a 20 years lasting one epidemic, endemo epidemic could be contained with this protocol, VCT protocol, with number 18 the children got affection. No deaths, thereafter no death at all. And then the number of cases recorded is nothing. And the number of deaths also nothing. So what shows this? It shows it is the efficacy of the new approach, that the Hahnemannian principle, on the line of the Hahnemannian principle, or as already explained by Dr. Asok Kumar Das, and that shows that this is the only way out to contain this kind of chronic nature of the epidemic, that depend upon the genus epidemicus, because this is a pandemic. This is not that, because genus epidemicus is the medicine should be applied to the particular area on the particular the time and the season and the period. Only that the genus epidemicus, only to that those area, it can be given as the preventive medicine as well as curative medicine, on the basis of the majority of the cases are cured with that particular medicine. Cannot be applicable. This kind of recurring nature and also the pandemic nature of the disease, or the that sustaining nature. So again, the problem, that relevance of the each that medicine, that already explained by Dr. Das. I am not going to that area. So I wanted to project that. See, this method, actually I am very proud of it, that I can examine or the introduce this method in homeopathy in India. So this is the only method. I think that this is the only method, only that protocol can contain this epidemic in our land. Only thing that this should be given, this protocol should be followed very systematically. We have that interval, everything is prescribed very scientifically and homeopathic principle. This protocol needs only one-time application. This intervention, this is only one time. It's 30 for 3 days consecutively in the empty stomach. Then after the 16th and 17th, 18th days, phosphorus 30 and 3 doses, and thereafter on the 31st and 32nd days tuberculin 200. Again the 46th day tuberculin 1 dose, and 2 months only 10 doses of medicine. That these 10 doses are sufficient to give protection for till this pandemic that exit from our land. So that is very relevant. That according to the earlier that government advisory recommended by the CCRS people as the Arsenicum album, say 3 days, as in our protocol also, the first one that we have adopted from them, and that medicine should be given every 1 month, every month. It should be repeated till this pandemic exists in our land or in the community. So how long it may take? Now we came to know that different variants may come. We don't know the effectiveness of this medicine, whether it would be the competent to contain that the variant, the muted virus also. But in our, and that Dr. Das has already pointed out, one medicine repeatedly in the taken, it is not good according to homeopathic principle. And again that now recently, after their observational study they have conducted in their institutions, and they recommend that it should be Arsenicum album should be given every 21 days, every 3 weeks. And they have observed that that medicine has got only effect for the now again that recently today, they are 3 days back, that they have issued another directory advisory part for prophylaxis in children, for the guidelines in the children. They have prescribed Arsenicum album 30 daily twice, 4 pills daily twice for consecutively 7 days. What does it mean? We cannot understand. Only children, earlier part, the 2 pills only, that were 3 days. But here they are recommending for consecutively for 4 pills, as in the case of the elder man. So we cannot say that. See, that is very bad. They say they know very well about the effectiveness of the BCT, and we have suggested, our proposal has given on the basis of the on the strength of that efficacy of the anti-miasmatic approach in the case of the Pallis encephalitis, and then medicine application in other states. Thereafter, after 2003-4, they have done a pilot study with the help of the Ministry of AYUSH in the year 2003 to 9, 4 to 9, and the whole results was the efficacy was assessed by the Isaac Golden. That he was the very the homeopath from Australia. He he was analyzed, the scientifically analyzed and showed that this observation study, he got the efficacy is about to 85 to 90% efficacy was proved. And yes, ascertained in the his article in the COVID-19 special, which was also published by the CCRX. This protocol, this application, but still they wanted to do the clinical trial. But we have already taken the many steps to conduct the clinical trial. Before that we have to register in the Central Registry of the Clinical Trial Registry of India, CTRI. Then every steps we have taken and all the preparations. But the problem, they wasted our option from the concerned state. According to the Epidemic Act, that this is very difficult, and only 2 states have given the permission. We could not apply to the CTRI registration. Therefore, that by the time number of even in the first wave also, the thousands of people were affected, and all persons become, the public become, citizen become panic, and then we approached to the chairman of the scientific advisory board to give the medicine without clinical trial, or if it is required, it could be done at the CCRS units in different states. All these states, they have got the competent that persons, research fellows are there, and the infrastructure is there. They have got the authority, but they did not task force chairman this task force was approved this protocol, and they have specifically asked to us that in the analogy of BCT you submit a proposal, that the clinical trial proposal, that scheme, and we have also submitted within a short time. That was the work we have done. Then due to the some kind of did not undertake our the request, and this is the present position. Now the people, now our request is, they already proved the vaccine has also only got 60% the protection. So this is the time to give this our protocol, and more the contraindicated people, that those persons are not getting the vaccine, and vaccine it takes more time. So that thing was already in this situation, that our further the humble request before the authorities as well as the entire professional people and entire institutions in under the homeopathy profession, they should understand that the Hahnemannian principle of the containing and the preventing this type of epidemics or the pandemic, and only for the save the health and wealth of the nation, and so this is the only alternative. That was only our request before the entire people, even the National Institute, I came to understand that there are more than 4,000 alumni are there. 4,000. Actually, we are the lucky people. The highest institution in the nation are the aims like that. In the case of that modern medicine, National Institute, the highest institution in the country. We are all that opportunity to undergo take the study there. So it is our responsibility, the National Institute's alumni and the faculty members, their responsibility to the humanity. That is, this should be contained within a short span of time through our you have already our slogan, as already our that logo I have already explained by Dr. Asok Das. That is scientific economic and effective medicine. At the same time, this medicine is affordable to all and acceptable to all, even to the children. And again, it is that is very accessible to the people. And so, on the basis of that, everybody should unite together. Our entire professional people should unite together, and you take the initiative, because we are at the top institute. So I request the authorities, and I express my thanks to the organizers to invite us to present this new protocol before you. And I am very, it is too late, I know, that I am giving that whatever the doubts you are having, it is that everything will be cleared in your, that Dr. Asok Kumar Das is there, and he is able to that express words for our the patient hearing of my voice. And I am thanking you all, and good night to all of you, and wish you all the best. Thank you. Thank you.
Thank you, sir. Sir, I request you to stay back for some time. And thank you, sir. Thank you, Professor Dr. Ravi and Nair, sir, for sharing your view and long-length discussion on relevance of APT protocol to combat COVID-19. And also, sir, thank you for sharing your experience and knowledge regarding the BCT protocol, which was used to combat Japanese encephalitis in the year 1999 to 2004. So we have with us Dr. D.N. Kalyani, and we have with us on the show Dr. Bidyut Mukherjee, our Secretary of Alumni Association. With their permission, I would like to request our backstage editor to bring Dr. Asok Kumar Das on the show.
Pralay, a request before that. We have to make that appeal for the Benevolent Fund.
Yeah, sure.
First let's have the Benevolent Fund. In between the two contest winners will be also on the screen to ask. So you just invite them after that appeal.
Okay.
All the viewers and the alumni of NIH, we all, as Dr. Nair, Professor Nair had said, we all should come together and be united. And from first batch of DIPNIH, of the flagship started by Dr. Professor Nair, S.K. Bhattacharya, Ishwar Das sir, Radhikari sir, and long list in the first batch. Then came the first batch of BHMS with Pralay, myself, Trideep, Gautam, Chandru, and lot more list and the fray. Then came the first batch of MD with Dr. Professor Rajat Pal, Kishore, and another long list to add on. So we have so far almost 2,000 plus alumni all throughout the globe. We now have a chapter in Sri Lanka. We have our Sri Lankan chapter representative over there who has been the president of Sri Lankan Council. We have our alumni in Nepal, in Canada, in Australia. Apart from all states, each and every corner of India, we have a humble appeal to help all the alumni who are in distress. So we had, on basis of the appeal from few of our alumni, we had formed a benevolent fund, and we request every member to contribute on that benevolent fund. The account number of Punjab National Bank along with the IFSC code, we don't have any UPI, but the IFSC code and the account number is given in the description of YouTube of this show, as well as in all the shows of our Alumni Association YouTube channel. So membership charges are nothing but 100 rupees per year, starting from 2010, the time we had started operating our bank account. So you calculate the alumni who are viewing it or will be viewing in the later stage. You calculate your membership dues, as well as we requested every alumni to contribute at least an amount over rupee 1. Whatever be the amount, it can be 100, it can be 1000, it can be 101, it can be 5 rupees, anything. Your together contribution till date, we had been able to uh, help. I should not use the term help. We had been able to be by the families of 5 alumni, of which we lost 4 and the other is back from the hospital. We had spent 1,75,000 already, and we have a balance for of around more than 2 to help in people in distress in future. But we need to make this alumni benevolent fund to be a stronger one. And thanks all for generating the help in the past, as well as we expect to do them in the present as well as in the future. Now over to you, Kalyani sir and Dr. Pralay.
Thank you, Bidyut. Dr. Mukherjee, thank you so much. Kalyani sir, would you like to say something right now, or you will be talking later on?
Later on.
Okay.
Later question and
sir, as a follow-up, let us step into the chapter that, as we all know, that we do have a competition on certain questionnaires before we take this episode of CME, and in that competition we have a 2 winner by drawing a lottery, and at least 50% have participated in this question answer series. And I'll recall and I will like to announce 2 of the name, and I will request our backstage editor to bring on the dais Dr. Naveen Kumar Srivastava. He is from Allahabad. I'll request a backstage editor to bring Dr. Naveen Kumar Srivastava. Dr. Naveen, please introduce yourself.
Hello, sir. Good evening. I am Dr. Naveen Kumar Srivastava.
Yeah.
And sir, my question.
You are studying where? In which college?
I am studying in. Currently, I am Alumni of State LBS Medical College, Allahabad. I am here in Gorakhpur.
Okay, Dr. Naveen, keep in touch, and you do have any question to ask?
Yes, sir.
And you will ask question to Dr. Nair, or you will ask question to Dr.
Dr. Das, sir. My question is for Dr. Das. Sir, how can we apply this APT protocol in post-COVID complications?
Okay.
Hello.
Yes, sir.
One thing please keep in mind, this APT protocol is for prevention.
Yes,
that means those persons who are now not affected, you have to give this and it will prevent. But for post-COVID complications, you have to treat according to the symptoms of the person.
Okay.
You understand my point? But
yes, sir.
What we have to do? Okay.
Sir,
thank you,
sir, one more question. Yes, sir. Yes, sir, in case of psoriasis, psoriasis case, when they are relapsing, what are our treatment approach in that case?
Dr. Naveen will discuss this part in later on, because we do have a series of questions related to today's topic, what has been discussed. We'll look forward, and in some time in next seminar, or you keep in touch with us. We'll be answering your question, and Dr. Das will be very glad to answer your question in near future. Thank you so much, Dr. Naveen, for joining. I'd like to request the backstage editor Sri Orko Mukherjee, to bring Dr. Jaslin Luthra. Dr. Jaslin Luthra on the dais. Dr. Jaslin, please unmute your. Hi, Dr. Jaslin. Hello. Yeah, Dr. Jaslin, I know you are from National Institute of. Good evening. I know that you are from National Institute of Homeopathy. You are doing your post-graduation.
Yes,
You work in Delhi in CGHS. Very glad to get you here in this webinar series. And do you have any question, Dr. Jaslin?
yes, sir. I want to ask one question from Dr. Ashok, sir. So, what has
Yeah.
been your personal experience in management of moderate and severe cases of COVID-19 during the second wave?
Please repeat. There
Please
is some
repeat.
disturbance regarding
Yeah. So,
treatment.
what has been your personal experience in treating moderate and severe cases of COVID-19 during the second wave?
You see, so far I have treated that mild to moderate cases, but severe cases I don't have the opportunity to treat because for severe cases
Okay.
we need hospitalization ICU as it is not permitted. So I have no experience of treatment of severely affected COVID-19, but definitely I have treated mild to moderate cases with very good success on the basis of the symptomatology. There is no specific drug. It may be Brania, it may be Rustux, it may be Maxol, it may be Liparsal, whatever may be. But experience is very good, especially in case of treatment of mild to moderate cases.
Dr. Jaslin, do you have any question? Any more question? Do you have any more question?
No, sir. Thank you, sir.
Yeah. Thank you,
No,
Dr.
sir.
Jaslin, for joining this
Thank you.
webinar. Thank you so much. And on behalf of National Institute of Alumni Association, we thank Dr. Naveen Kumar Srivastav and Dr. Jaslin Luthra for their active participation. And we look forward that in near future you will be joining us. Now let us go to the question answer part. And we do have several questions, multiple questions related to the discussion of APT protocol today. And this question is almost to Dr. Ashok Das. The first question I'd like to read out, it is from Dr. Ujjwal Mandal. Though the question needs a long discussion regarding the immune response, still, sir, I am reading out this question that he says, who will suffer more? Who will suffer more? Person have strong immunity or person have weak immunity? Reference to cytokine storm.
I already explained that cytokine within a normal limit is essential for fighting the viral infection. But if there is excessive release of cytokines, that leads to cytokine storm and that leads to fatality. So please try to understand the cytokine within its normal limit is helpful to fight against the virus. But the same cytokine, if there is excessive exaggerated liberation, that leads to immunological reactions which leads to death. From homeopathic point of view, we can say this is syphilitic miasm. You see, the same disease who are syphilitic, their destructive nature, auto-destruction will be there, and that's why there will be cytokine storm. So definitely you have to consider not from that angle, weak immunity or strong immunity. If the reaction is normal, within normal, that will lead to successfully destroy the virus. If not, there is cytokine storm that will also destruct the whole response, leading to death. Okay.
Thank you, sir. And here is another question. This question has been put by Dr. Gautam Ghosh. He says, sir, does bacillinum will have some same effect like tuberculinum? The Ashok Das, sir, I think, sir, Dr. Nair can reflect something into it. Sir, the question is that in place of tuberculinum, whether we can use bacillinum or not.
See, we have given that bacillinum and tuberculinum maybe was where And even then, that the proving also may be seen that most of the symptoms similarity. But we have used this tuberculinum effectiveness in containing this epidemic that is already given in the Japanese encephalitis, and again that we have also gone through the symptomatology of the tuberculinum, and that earlier that you know that tuberculinum aware, no, that medicine was there, much more affinity to affect the lung tissue. So that is not possible, that it is not available anywhere. So it is better to, that's why that we came to a final conclusion that tuberculinum is enough, and that is available everywhere. So that is the how we could be prescribed this tuberculinum in this our protocol. That we got good results. See that, you know, that another important thing I use that this is that remove the susceptibility and to that particular disease condition which caused by the coronavirus. You know that already Dr. Das has explained that upper respiratory tract is affected, and the cold and coryza is the primary symptoms, and that's why that we have given that Arsenicum album. See what happened, that I used to get once every year at least 3-4 that cold attack. Cold attack, it may last for another nearly 7 to 10 days. And after taking that one course of this medicine in the last June, July, this 1 year, I did not get any attack, cold attack, even this bad climate. And to my wife also used to get very cold, and my daughter, and everyone is protected by this medicine. That shows that it is not we are not prescribing the prophylactic on the basis of the causative agent, or on the basis of the susceptibility. So we have succeeded, and we have proved that tuberculinum is most effective anti-miasmatic drug in pandemic. No doubt. I am very confident. So on that,
Thank you,
my
sir.
own
Thank you, sir. And sir, because of a time constraint, we will be little bit faster. And
Okay.
here I would like to put another question to Dr. Asok Das. That we have a similar nature of question. The question is from Dr. Purnima Menon and from Mr. Arsad Ali Said. They says that please explain the exact posology and interval of arsenic, phosphorus, and tuberculinum. And I think, sir, it has been well described during your lecture. Moreover, to the viewer, I would like to focus that entire this episode of explanation will be available in the YouTube, in the National Institute of Homeopathy Alumni Association YouTube channel. You will get it. You can hear it. You can listen to it several times. The doses and repetition. Dr. Das, sir, will you like to focus something into it, sir? They are asking about the exact posology.
So I suppose within I will take only 1 minute.
Okay, sir.
One case in first Arsenicum album 30, 3 doses. In case of adult, 4 globules, number 30. In case of children, only 2 globules. So this is for 3 consecutive days. Followed after 15 days, phosphorus for 3 days, having the same dose. After 15 days, tuberculinum 202 doses. After 15 days, tuberculinum 1M single dose. After 15 days, tuberculinum 10M single dose, and that is the end.
Sir, thank you so much, sir.
Yes.
And here is another question. It is very relevant question, in fact. This question has been asked by Dr. Kundu and as well as Dr. Ujjwal Mondal. That the question is related with the vaccination. If anybody taken COVID vaccine, then at this case, how COVID ATP protocol will act?
You see, if you go through the whole immunological system, there are two types of immunity. One is innate immunity, that is immunity which is present since your birth. Another immunity is an acquired or adaptive immunity. So these two types, one is acquired, and in allopathic science, they are stimulating the acquired or adaptive immunity. But in homeopathy, if you think of, this stimulates our innate immunity. That means whatever, if you have not the exposure to that virus, the particular person has from the birth has the certain immunological cells to fight against the particular virus. That's why if you go through the immunology, you know that this is the reaction of innate immunity followed by acquired immunity. In homeopathy, we stimulate the innate immunity. As I told you that if you go through the tuberculinum, here they're explained that it stimulates the innate immunity. And that's why, and that innate immunity is not related to specific to particular virus. Okay. So any person who have COVID vaccine may also take homeopathic potentized medicine or APT protocol. It will give double protection, one from innate immunity, another from acquired immunity. In fact, there is a good correlation between innate and acquired immunity also. And it will take a long discussion. But what is my intention, what I have told you, that it needs to work scientifically, that after giving homeopathic APT protocol, what I am claiming that is it the innate immunity or acquired immunity, that should be studied. Because to produce an acquired immunity, it needs certain antigenic reaction. But here, the arsenic, phosphorus, tuberculinum will not be able to produce that type of antigenic action. That's why it is our assumption, or from homeopathic philosophy, you can say that it stimulates our innate immunity so that it goes to the susceptibility, modifies the susceptibility of the person so that he will not be affected by the virus. Please keep in mind, it is very important to understand the person only being affected by a virus provided it fails to fight. Who will fight in the beginning? The innate immunity. That's why while we are thinking that homeopathy, it stimulates the susceptibility of the person, that's why we are thinking that it stimulates the innate immunity of the persons. But to establish this concept, we need much more study, immunological study. That's why I'm talking that we need to include some immunological parameters to study the effects. Okay.
Thank you, sir. Thank you, sir. Here is another humble submission from Dr. Shomit Hajra. And I would like to put this question to Dr. Professor Nair. That his question is, would this protocol be continued for a recently infected person? Would this protocol be continued for a recently infected person? Within bracket, he writes, if one has already started with the protocol and gets infected midway through the protocol, bracket closes, or do we go symptomatically? Nair sir, am I clear regarding the question?
I'm not clear about the question that what she wants.
So, Dr. Shomit Hajra asks that would this protocol, means ATP protocol, be continued for a recently infected person?
Recently infected persons, that means already that he got the positive, thereafter that become negative after treatment, and whether that they require this preventive protocol is required or not. Of course, that different variants are coming. Then that the anti-miasmatic protocol will prevent even the new variants also. That is that I told you that
Hello.
that
Hello.
the positive agent, it is removing that susceptibility to that disease condition produced by this the virus. So susceptibility is removing from our constitution. So that is why we are giving the deep acting anti-miasmatic drug. Susceptibility is the main factor, but the other people that they are giving the only the immunity for antibody
Hello.
is for creating. But here it is our method is entirely different from that of the modern medicine. Okay, so
Hello.
we can
so
take.
much, sir.
Yeah.
Thank you so
Actually-
much, sir. For
Hello.
Dr. Das.
Yes, yes.
Yes, Dr. Das, we can hear you.
Yes, one thing, actually, Sumit, he wants to say that while continuing a APT protocol, if somehow
Right.
some person affected COVID-19, whether what to do. In fact, then you stop the medicine and whatever symptom you get on the basis of which you treat symptomatically. You understand my point? If you see that what is our experience, suppose you have started arsenic, 3 doses. After 2 or 3 days, again he suffered from the symptoms of COVID-19. What to do? Stop arsenicum album, consider the patient, all the symptomatology, and prescribe accordingly.
Thank
So,
you, sir.
please keep in mind, this is not for the treatment. This is only for persons, only to prevent. So, if such person develops that one symptoms of COVID-19, you have to treat by that medicine indicated. If it is indicated phosphorus, you can give it. Otherwise, you have to consider the medicine on symptomatology.
Thank you so much, sir. Thank you so much, Dr. Asok Das, sir. Here is again a very similar question. I think it will be comfort. It will be in comfort zone if I ask this question to Dr. Asok Das.
Yes.
Here is a question from Dr. Jugantor Bose. He says that, sir, if anyone already infected and recovered, can they take it at this second / third wave of COVID-19 for prevention and in same manner?
Yes, yes. Because you see, once you have recovered from COVID-19, that does not mean it will not recur. So prevent that recurrence, yes, you can give homeopathic disability protocol.
Thank you so much, sir. Sir, we are left behind very few questions.
Yes.
Maybe a 5 to 6 question we have to answer.
Yes,
And
yes,
this question says about the feasibility and activity of ATP protocol. Like we do have a question from Dr. Pranav Bhattacharya. How many patients this ATP protocol has applied? What are the results? Please show the statistics.
No. How many?
How many patients this ATP protocol has applied? Means how many target populations you have covered, in fact, and what is the result?
So one thing I told you, this is not for the application on patients. This is
Right.
application on persons, those who are healthy. Till date, we have already applied this protocol on more than 2 lakhs people. And this is our observation. We are calculating. We are in the process of preparation of statistics. But average, very, very few persons are affected. Those affected, they are mild symptoms. Very few persons with comorbidities that they get hospitalization, but no death till date. But if you say immediately, so this statistics is under preparation. We are collecting all the informations.
See, in this connection, I wanted to say something. That we have given in several groups. Hello.
Yes, sir.
Hello. And in Trivandrum, one nascent academy of homeopaths that is regularly meeting every month on third Sunday. This is since last 14 years continuing here. we have got a good group of practitioners here. We are learning homeopathy. And in the month of last April, May, I have proposed this protocol before them, and the most of them, they have adopted this protocol in their preventive medicine. Last week, I had collected all the data from them, and my question was only how many persons they have given this medicine, and we wanted to know how many persons got the HIV COVID positive become after taking this, and I got that total number, and 14,450 that persons had taken than 11 practitioners in Trivandrum in different clinics, and they are given this medicine and observed that they directly contacted that each person, and they have obtained their telephone number, everything, and whenever they get any infection, immediately they report the concerned doctor, and they got only out of this 14,450 persons have taken the medicine, only we got 98 persons got one mild attack of the 3-4 days, or the 3 days within they become negative, no problem. So that gives us the very confident. I have given the many other groups, and in Sharda Krishna Homeopathic Medical College also, we have given every student every their protocol. I have shown that that in every year we used to publish the students' handbook. In this year, the handbook we have given that protocol, and those medicines are given under the supervision of the academic in charge of the each batch, and they have given very systematically. They are saying together, and the classes were gone so many years, so many days, and they were also, we got very few people, those also only asymptomatic patients, and their mild form of attack. So that shows where also we got less than 1% people got infection. See, that's what does it shows? And many other group, I know that we are collecting the data.
Yes, sir. Thank you, sir.
Again, we can more disease more effective and yes. Hello.
Thank you so much, Dr. Nair, sir. Thank you so much, sir, for answering. In fact, this answer deserves a round of applause. Sir, I would like to put one question from Dr. Kavita Thapa. She says that, sir, is the dose and repetition same for children and adults? Sir, is the dose and repetition same for children and adults? This is a question from Dr. Kavita Thapa.
I told you the dose, these 2 globules in case of children, 4 globules in case of adult. That is globule number 30. And the interval remain the same in all.
Thank you so much, Asok Das, sir. Here is another question. Then question is from E.L. Suchiang. She says that, sir, share personal experience following APT protocol and their follow-ups till date.
You see, I forgot to tell you, in fact, since last 1 year, May to 2020, we are preaching this concept to our students, colleagues, different NGOs, and now we can show you. Suppose Anandamarg, there is an organization, they have given about 150,000 people, and they written to us that not a single person till date was affected. Next, there was an area in Bardhaman, in particular this Panchayat, Anchal Panchayat, they take the responsibility to distribute this particular APT protocol medicine within this Panchayat area to about 3,500 persons. None of them was affected. So I am collecting not only from different students, that whatever the result, what is the result, that we are accumulating now. So what I want to say that about personal experience, I told you already, my patients and relatives and friends who are directly in contact with me, none of them suffered seriously from COVID-19. So this is my personal experience, highly effective, but it needs much more study. If I say this is nothing but an observational study, as a man of science, I can say, okay, it has certain limitations. There may be some thing others. For it needs double-blind randomized clinical trial, or include to show that there are the parameters, immunological parameters that has changed, and that's why it leads to prevention. That is the work of the CCRH and other people. But till date, what we'll do, we have to save the life of the persons. And homeopathy is based on not on clinical trial, not on scientific studies, but on the basis of the homeopathic philosophy law.
And,
So for
and
the
the
time,
remedy.
let us accept that one, use it, and save the people. But at the same time, try to do the study. Okay. Okay.
Sir, thank you so much, sir. We do have many questions, but we'll take at least 2 to 3 questions more because of the time constraint. Sir, I would like to read out one of the question, very interesting question, and asked by Dr. Manjari Archak. She says that tuberculinum 1M safe for senior citizen, and please tell the protocol for kids below 18. She also asks that tuberculinum 10M, is it safe for senior citizen?
Yes. You see, it is a fact that senior citizen, if the patient has some irreversible pathological process, ongoing process in a particular person, you can check the person and then you can give that one. But up to 201 you can give. But if you have irreversible pathological changes and the patient is under your control and supervision, you can give, provided there is no active tuberculosis, no active disease in person. Otherwise, senior citizen means that something may be very healthy. So I think you can take the decision yourself to give this one. But it is our personal experience. You can say that one dose of tuberculinum 10M or 1M will not be harmful. Till date, what is our experience?
Thank you so much, sir. And sir, again a question from Dr. Gautam Ghosh. He says, can there be a chance of adverse reaction after giving tuberculinum 10M to an asymptomatic COVID patient or post-lung tuberculosis patient having fibrosis in the lung?
Please keep in mind, whenever you have post-COVID complications, you treat according to the symptoms. Why you are thinking about giving that one? Please try to listen. If you have COVID complications, post-COVID complications, then treat according to the symptoms of the patient. Then there is no scope for adopting APT protocol. You understand my point? I repeatedly told you this is to be given to the healthy persons or apparently healthy persons who are not yet affected. If affected, then also we can adopt this protocol to prevent further recurrence. But if you see that there is severe fibrosis, or then you better to avoid, or you can give in 50 millisiemens potency. You understand? You see, in an epidemic, we have to consider the general public also. If it is your patient, you can take your decision according to your knowledge from our homeopathic philosophy. That will be the best. Generalization, we are speaking about generalization because we give to mass people. But if you have the access to the individual patient, you take the decision according to the homeopathic philosophy.
Thank you, sir. And we do have many questions are coming up in the screen, sir. But to end this conference in the webinar, that already 3 hours is over. Because of the time constraint, we'll take just one question from Dr. Sharnodi Bhattacharya. He says, what about the bad effect of vaccination? Vaccinosis concept of Dr. Barnett. will we first use some drugs first to combat the bad effect of vaccination first, then to apply ATP protocol? Sir, am I clear regarding the question? He says whether if somebody is vaccinated, then whether we have to combat with the bad effect of vaccination, then only we can continue with APT protocol.
You see, first, which vaccine? Allopathic vaccine? I am thinking that it is a allopathic vaccine. Now, if after giving allopathic vaccine, if there is any bad effects, then you have to treat according to the symptoms of that individual person. Why you are considering APT? I repeatedly told you that if there is any adverse effect after giving allopathic vaccine, treat the patient according to the individual symptom totality. You understand my point? It is not APT protocol is for those. Okay, you treat the vaccinosis. If there is any bad effects, you treat according to that.
Sir, it went a very wonderful program today. And if you permit me, sir, I will put a last question, and it is from Dr. Pranav Bhattacharya. Before that, I would like to say that there are number of questions still scrolling in the screen, at which cannot be answered right now because of the time constraint. We are already 3 hours over. A senior person, senior citizen like Dr. Nair is waiting for his dinner. We all are waiting. Dr. Kalyani is waiting. So this would be the last question to be placed before Dr. Professor Ashok Kumar Das. This is a question from Dr. Pranav Bhattacharya. He says whether this APT protocol is applicable for all, irrespective of any age, sex, with different comorbidities. Please clear it. Can we give this protocol to all the patients, means population?
All the persons.
Please keep in mind, very short answer. You can give at any age, any sex, anyone, provided there is no such contraindication or irreversible pathological changes in the body. Any age group, age, sex, pregnant lady, lactating mother, everyone you can give, provided
Safely.
the person have no irreversible pathology in the body.
Thank you so much, sir.
Okay.
And
Another thing,
The food safety.
You
Sure,
see,
sir.
I think this has given a lot of interest among the participants. If they have any question, let you take all the questions and send to my email. We can discuss,
Right.
because we would be happy to
We are
discuss.
ready to answer it.
Yes, yes.
Right, sir. Right, sir.
Yes.
And sir, I do apologize to all the viewer that some of the question we could answer, and many of the question remain unanswered. And to view that, Dr. Das has very eagerly has wished that he will be ready to answer all the question. If you forward this question to him or to the organizer of National Institute of Homeopathy Alumni Association, we look forward that he will keep on putting the question in this webinar in near future. With this view, I would like to thank Dr. Ravi and Nair, sir, and Dr. Ashok Das, sir. Over to Dr. Bidyut Mukherjee, over to Dr. Kalyani, sir.
Many thanks. Special thanks to our senior first batch, Dada, Professor Dr. OBM Nair, for his first experience, first observation. It's a brilliant observation. All scientific inventions, they are pioneers or observations. And we are very lucky that our friend Dr. Ashok Das, somehow he got the information and he put maximum effort to verify. So experiment was done by Dr. OBM Nair. That was verified by Dr. Ashok Das through many persons, and its confirmation, it was told by Dr. Ashok Das, we should wait for some time for statistical data. That will be a very great landmark in the history of homeopathic system of medicine for giving this type of cryoprotections. So anyway, so thanks to all the viewers or participants. Probably this is the lengthiest CME ever we have experienced, more than 3 hours. Definitely it has given a great scope for learning many things. So thank you all, especially Dr. O.B.M. Nair, Dr. Asok Das, Dr. Pralay Sharma, Dr. our Secretary Bidyut Mukherjee, his son Orko Mukherjee, our editor, backstage editor, and all the viewers. Please come forward, suggest your desired speakers. We will try to bring him in the screen. So thank you all. Over to Bidyut to conclude.
Thank you, sir. Thank you. And we are already 3 hours, 10 minutes now. But it's a great learning phase. And that also for the suffering humanity across the globe. We are proud to present such scientific contents and discussion on our platform. And as suggested, we thank Dr. Pralay for such a brilliant moderation tonight. With all the patience, he had summed up so nicely all the questions. Had summed up so nicely. I was just sorting out the questions for him, and he summed up brilliantly. So it's a gallant team effort for all of us, and we look forward for our next session on 27th of June. In between those questions which had been unanswered will surely be sent to Professor Dash and Professor Nair from Alumni Association. And with this, we take you back to our backstage editor tonight. Good night, everybody. Stay safe, stay healthy.
Good night.
Thank you for watching. Those who have watched this stream till now, this is the lengthiest stream as said earlier. I hope you have enjoyed it. If you have liked it, do make sure to like it. And if you're watching this in the recorded version, you may see, in order to get the version, you may see by tomorrow, those who are watching live also, by tomorrow, there will be an option right over here, somewhere over here. You can click over there and go to the CME and main CME part. We have sorted that out. We will sort that out in next day or by Tuesday. So again, thank you. If you want e-participation certificate, the link is given in the description. Please check it out. And if you have not, if you want day-to-day updates about us, then please check our Facebook page and like our Facebook page, and also follow our Instagram. We are on Instagram and Twitter. Do follow us. And also, thanks again. And finally, sorry, the final main part. Please do subscribe and hit the bell button to get updated very early whenever we schedule our next CME. So until then, it's me, Orko Mukherjee. Peace out.